Hello, I'm Dr. Fred Lorenz, ear, nose, and throat specialist here at Ozarks Healthcare. When it comes to allergy problems, even the fall can cause increased symptoms because of the pollens related to ragweed and other types of weeds. Many people do confuse sinus problems with allergies, and there is a definite difference between nose problems and sinus problems. Most of the time, allergies are related with what I call the watery, itchy, sniffly, sneezy symptoms. Problems that are related to colds or flus are going to potentially be sore throats, more nasal congestion, possibly some fevers, and possibly yellow or green discharge from the nose or in the throat. Nose and sinuses are directly related because if the nose has an inflammation, it can block the drainage points of the sinuses, and the sinuses can get irritated or possibly infected. So if there's a potential fall allergy involved, or with colds and flus, and this year especially with COVID ongoing, there are problems that can occur in the nose and sinuses directly related to those types of things. Another factor that can contribute to the nose and sinus issues is a weather change. Weather fronts and weather conditions can certainly cause problems with the nose and sinuses, as they do contribute to the amount of swelling and secretions produced, and barometric pressure changes can also affect the nose and sinuses. Many people don't realize that simple nasal treatment can prevent problems developing into sinusitis. Saline nasal sprays can be used any number of times per day to keep the nose moist and flushed out and fresh. There are people that will use that as often as every 10 to 15 minutes during the dry time of winter, and with the furnace on, or if you have fireplaces or dry heat, it oftentimes can make a big difference in how a person feels breathing through the nose. If a person has a cold or a sinus infection, saline sprays are great as well. And if you have a true sinus infection or a history of sinus infections, you can use sinus irrigations that are available in different forms, including just bulb syringes to neti pots and bottle squirts that can clear out the sinuses, and there are some mechanical irrigators as well. Many people will have a sinus infection once or twice a year, and it's not necessarily anything that needs to be treated more than with decongestants, steroid sprays, and antibiotics, and that usually clears it up. In cases where people have 3 or more serious infections with lingering symptoms that go on for a month or more, then we start worrying about chronic sinusitis, and by definition that's something that goes on for 12 weeks or more. Those are the cases that may need to have some type of sinus surgical intervention. I am available for patient visits by personal patient request or by referral from other physicians. You can call anytime. Appointments are available relatively quickly, and I take all patients that are wanting to come see me.